Are you a dental hygiene student who is struggling with cranial nerves? Hi, I'm Aniston. Let's talk about it. Okay, so there have been mnemonics before to remember between sensory, motor, and both. And now that we have a new vocabulary with the internet, I have made one. Some say marry money, but my bestie says boss babes make money. And that goes in order from cranial nerve number 1 to 12. Okay, so first nerve is going to be olfactory. That's our nose. Olfactory, I think of a factory with steam, right? So in this case, this is sensory. It's a smell. Your senses, right? This one, guess what you use this for? Smelling that perio breath. Number 2 is optic. I need to see in my loops. It's for vision, it's sensory. Number 3 is ocular motor. 3 moves eyes freely. You can move them all around. This is a little example of what the eye moves. Not only does ocular motor help move the eyeballs, but it also helps to focus with the retina. So guess what? When you look in the loops and you're probing, it helps you focus on the little lines. Number 4 is the trochlear. Number 4 you can think of when you put on the loops and you have to look down, right? You're looking down. That's the muscle that helps you look into your loops. Number 5 is the trigeminal nerve, the one that we love, right? The trigeminal for your eyes, your maxillary, and your mandible, right? This one you can think of water splashes into your eyes. These, you can feel the pain, right? And then for maxillary and mandibular, right, you have to do injections for anesthesia so you can numb the patient. It's also used for chewing, so it's motor and sensory, right? Number 6 is abducens. You can think of when a patient says that they floss 2 times a day, but they're calc-free. Number 7 is the facial nerve, right? That's for smiles, saliva, and some tears, which sometimes happens in a dental office, or even us when we're stressed. Go to school. My patient didn't show. And then facial nerve, you're so happy that they're there. And salivary gland when they gleek at you. So for facial, it also has the sensory, right? It's motor and sensory. It helps with tasting with the anterior 1/3 of the tongue. Number 8 is the vestibulo-ocular. That is for your ears. So this is for equilibrium and hearing. You can think about this when you're using the cavitron. You have to hear if you are adapted correctly onto the tooth. So you need to balance, right? Equilibrium. You can think about it that way. Balancing on the tooth with your fulcrum, and you're trying to hear if you're adapted to the tooth. Number 9 is glossopharyngeal. I don't know why, but every time I see glossopharyngeal, I think of like a lip gloss. My lip gloss is cool. My lip gloss is poppin'. Anyway, so it's motor and sensory, so it senses the taste in the posterior 2/3 of your mouth, right? And the sensory would be the back and the pharyngeal when you gag and your gag reflex. My lip gloss is poppin', my x-rays are cool, but not when I gag them at school. I don't know. And it also innervates the parotid gland, so remember that. Vagus. That's pretty much everywhere. Kind of think of how like Vegas has the Eiffel Tower, has Statue of Liberty. It's got everything. And that also is motory and sensory, so it also helps with taste, right? 11 is your shoulders. You can think about how you're, up here in the patient's mouth and your teacher's like, drop your shoulders. You're like, oh shoot, I didn't realize my shoulders were up. That's your accessory nerves. You can also put your loops on your shoulders because it's your accessory. Number 12, the hypoglossal nerve. Guess what? This works for motor, right? And the fun thing that we love about tongues is that the tongues are strong. So when we're trying to retract that tongue, the muscle is so strong, it's like, no, let me, or like they're licking your instruments, they're looking at your fingers, you're like, please stop. So anyway, that's hypoglossal. Anyways, I hope you liked that, hope it helped. I also really like this drawing with all the cranial nerves to help you kind of visualize where everything is if you ever have a hard time. But yeah, I hope this helped. Good luck studying and I'll see you later. Bye.